Are you facing challenges in your health? Then Dr. Suleiman Clinic and Labs is here to provide you with the lasting solutions to your health problems. Dr. Suleiman Clinic and Labs is specialized and offers consulting in psychiatry, internal medicine, cardiology, urology, dermatology, gynecology, infectious diseases, and infertility. At Dr. Suleiman Clinic and Labs, we offer 3D/4D scan at just 5,000 francs, emergency ambulance, free ultrasound scan, and free medical consultations. Our staff is composed of well-trained doctors with good laboratory and best equipment. We are located in 2 cities, Boya at Mile 18 Bolifamba, and in Douala, we are located at Entre Pilot. You can reach us through the telephone number 694-940-172. Your health is at the right place with Dr. Suleiman.
We continue Hepatitis B Complication Part 2. So we understand all those fluids that accumulated in the stomach causing severe ascites is what we call abdominal ascites, severe. You see the liver like if it's swimming inside fluids. You see in the intestine as if it's swimming inside the fluids. This is all very bad. Now let's discuss. We said the albumin made by the liver becomes cirrhotic. It cannot make any albumin. You know, like we said, the regenerative capacity of the liver does not make you have zero albumin because there are still some cells that manufacture, but not enough to produce the normal range value, which is 3.8 too high to about 5 or so. So in this patient, we did the serum albumin and it was 1.5. So the lowest you can have is 3.8, almost 4. He's at 1.5. That's less than half. So when the albumin is less than half and is very low, like in this kind of patient, this case, then the plasma, the water inside the blood, inside your veins and arteries will ooze out. Because the thing that holds them inside the vessels, the blood vessels, is that albumin. The albumin is gone. So nothing to retain this water inside the vessels anymore, it leaves. It leaves where? To the nearby space, which is most of we have the aorta there, we have a lot of blood vessels in the intestine. So this is the cavity, the big cavity that accommodates all those fluids. So the abdomen becomes big. By the same token, the leg also will become swelling because there are fluids, there are water leaving that vessels because of the lack of albumin that is made by the liver into the nearby tissue and causing edema and swelling. Edema means swelling. So we have the eye swelling, we have the face swelling, generalized edema, generalized swelling of the body. We have the foot swelling, we have the leg swelling, and if you push your finger like this in your skin, it doesn't come back. It stays sunk. You know, it stays. If you got biting edema. So you put your finger like this, where you pushed, it doesn't come up easily. So that you know that you have some edema, you have some swelling. Albumin is expensive. It's about 120,000 for 20 grams. You need about, for this patient, you need at least 4 vials. That's about 600,000 right there. And it has to be refrigerated. So you have to be sure the pharmacy that sells you the stuff has proper conditioning to store this medication. There are now the powder that reconstitute into, so we can avoid the fridge during transport, because it's not made in Africa. It's made overseas and it has to be brought in. This patient goes for, extraction of those fluids from his abdomen every 2 to 3 weeks. So if I take about 3 liters of fluids from this patient, and the patient will become very weak. And it's just a matter of time, another 2-3 weeks, and the stomach becomes big again. So how am I going to fix the situation? There are good doctors that know how to handle the cases like this here. But most importantly, I want to give the patient albumin, because the liver is failing to make albumin, so I have to give the patient what the liver is failing to do, which is the albumin. So I will give the patient some albumin. In this way, I will keep the fluids in the blood vessels inside the blood vessels and prevent it from leaving the blood vessels into the interstitium or the abdominal cavity. So this way, and then I can take the fluids out of the abdomen, and most likely in the fluid accumulation in the stomach, in the abdomen, will not happen again. Now, there is also a way of us to look at this fluid that is coming out when we take it out, and it depends on some kind of we have to see the protein ratio there, and we have to see the color. Is it milky or is it yellowish? So we have to, this is also diagnosis criteria to know what is the most likely cause of you having big stomach, but this doesn't concern you. This is for the doctor to decide. The doctors know what they're doing. We discussed about albumin, and the deficiency of albumin causes you that big stomach. So what else the patient can have? The patient can have as well bleeding. Why? Because all the clotting factors are made in the liver. So if the clotting factor that causes your blood to clot and not to bleed is made in the liver, and the liver becomes bad, obviously you will be bleeding without stop. Except for factor VIII is not made in the liver. So that's another issue, bleeding. So what we do? Well, we have to give you those clotting factors. So we have to transfuse you with the frozen red blood cells, most likely. And we have to give, for the ascites, beside the albumin, we have to give 2 medications. I see sometimes prescriptions from other health professionals that includes furosemide only or aldactone only. No. The best treatment for this patient with ascites is a combination of aldactone, furosemide, and it has been determined by the people in the field, the Gastroenterologist Association, the American Gastroenterologist Association, that the percent should be 50 spironolactone or aldactone to 20 furosemide. We like to use 2 tablets to get rid of all those fluids. But then the patient is not drinking. Most of the cases, when we have severe abdominal ascites like this, we can also have right heart failure. Right heart failure. So that's another complication, that those patients with severe ascites can have right heart failure. Those patients as well, this is another complication, will bleed from above and will bleed from below. From the mouth, they throw out blood, and from below, they throw out fresh blood through the rectum. What happened? When the liver becomes so stiff and so small and so solid, we have increased the portal circulation pressure. Let's say there is a lot of blood supply inside that liver. We call it portal circulation. When it becomes smaller and cirrhotic, now automatically those blood vessels are narrowed. And when we narrow those blood vessels, we increase the pressure. The portal circulation, this pressure inside the liver is automatically, this high now becomes high pressure now, is automatically transmitted to the general circulation. So the veins around the esophagus, inside the esophagus, will swell. The veins in the rectum will swell. And when things swell, what is the progression there? They blow up, you start bleeding. We call it esophageal varices. The same thing in the rectum. So what we do? We band. We initially put them on medication, very simple medication, beta blocker, and that is a good way to prevent. So when a patient like this comes in, as long as he does not have asthma, neither diabetes, we can put them on beta blockers. non-specific beta blockers. Propranolol is 1,000 a card or something, or for a month is maybe 2,000. It's very cheap. But once this patient comes in, the next step to prevent varices, because it will happen. Varices is bleeding from the mouth and bleeding from the rectum. We have to put them in medication to prevent this from happening. It's not like we're going to prevent it. It's never going to happen. At one point it will happen. We just delay the happening for some times. So now, what else beside the bleeding? You bleed from your nose. Beside the varices that cause esophageal bleed and rectum bleed, what else can happen to this patient? This is all hepatitis B complication. The patient can go into confusion and hepatic encephalopathy. He's confused. He cannot focus anymore. He doesn't know where he is. He doesn't know what time it is. He doesn't know who's around him. General confusion. That is hepatic encephalopathy. So, and that we have a specific treatment for that. But this is all very bad complication, So I very much, explained, the complication of hepatitis B is very scary. It's very scary. Now the worst complication will be carcinoma. Carcinoma, hepatocellular carcinoma is most likely associated with hepatitis C, but hepatitis B can also make it, but to a lesser extent than hepatitis C. So can hepatitis C also cause liver cirrhosis? Yes, if it's not treated. Can alcohol, being alcoholic, drink too much alcohol, can it cause liver cirrhosis? Yes, because alcohol damages the liver. Now, for this patient with that big abdomen that we showed in the beginning of the video, we cannot give him anything, any drug that has to do with the liver, has to be metabolized by the liver. Like simple paracetamol, he cannot take, because that will aggravate the situation. That will aggravate the situation. And when the situation is aggravated, the liver is already bad, and you stress it out with medication that has to go through the liver, that's an injury, bad injury to the liver. What other complication those patients are prone to beside the cancer? Hepatocellular carcinoma. Those patients can go into renal failure. We call it hepatorenal failure or hepatorenal syndrome, meaning the kidney will shut down. Most of the cases, it's because of dehydration. The patient eats something, drinks something, because of his big belly, he feels pain. He stops drinking, he stops eating. So the kidneys goes bad. So in advanced medical facilities, those patients don't have to die. So, the story is sad. When you get cirrhotic liver and you advance to more complication, it is kind of sad. Because the liver is very important to us. It's one of the major detox, actually the only detox organ inside your body. That's why I emphasize and I stress out that you should be screened for hepatitis B.